Hello, my name is Dr. Amy Gulick. I want to thank the Western Organic Dairy Producers Alliance for giving me the opportunity to speak today on behalf of the Moody Project. Moody is a multi-university project that encompasses management of organic dairy young stock. That's a bit of a mouthful, so we have shortened it to Moody. Due to confidentiality agreements, farm identities and images are not included in this presentation. This project is seeking to bridge an existing knowledge gap for organic dairy young stock. And when I say young stock, I am describing dairy cows from birth to first calving. Though much research has been done on this age group in conventional dairies, little data is known about organic dairy calf populations. Morbidity, meaning the prevalence of disease, is largely unknown, but is estimated to affect about 30% of this population. Additionally, causes and rates of mortality are unknown, but are estimated to reach up to 40% in some herds. Just a quick overview of organic versus conventional dairies in a regulatory sense. According to the National Organic Program, replacement animals must be sourced from an organic herd. This puts additional pressures on organic dairy farmers as all of their replacement heifers must be organic. Thus, the organic young stock are an especially valuable commodity. Additionally, there are strict regulations about medication use with blanket bans on antibiotics and limitations on other drugs that can be administered to their animals to treat and prevent disease. Before these animals begin generating revenue, meaning calving and lactating, organic young stock are estimated to cost $2,300. That is compared to costs of about $1,000 for pre-revenue calves in conventional herds. This represents a significant economic investment in these babies. A survey of veterinarians in the American Association of Bovine Practitioners, or AABP, indicated the top challenges in raising organic young stock are respiratory disease and parasites, which is similar to that of conventional dairies. And these calfhood illnesses have a potential to affect future production and, by extension, future revenue. The long-term goals of this study are to improve the health and welfare of organic young stock and thus profitability and revenue for producers. This will be accomplished by identifying the primary risk factors for health, welfare, and performance in these animals so appropriate interventions can be made. This is a multi-institutional study, as I mentioned. Participating universities include the University of Minnesota, University of Vermont, Texas Tech, Colorado State, and Washington State. The diverse spread of universities across different geographical regions will hopefully give a broad overview of different organic rearing systems in the United States. This study is funded by the USDA and will encompass at least 2 years of data collection. Data collection began in fall of 2025, and preliminary results will be discussed at today's conference. Moody is an observational study. As mentioned, data collection will span at least 2 years with farm visits every quarter to enrolled dairies. Data collection is done on 3 age groups: neonates at 2 to 7 days old, pre-weaned calves at 6 to 12 weeks old, and post-weaned calves at 13 to 20 weeks old. I like to joke that our 3 age groups are babies, kids, and teenagers. Since respiratory disease and parasites are the biggest concern with organic dairy bovine practitioners, they are the focus of data collection. We will be doing respiratory ultrasonography, pathogen panels on nasal swab collections, as well as fecal parasite identification. All age groups will also receive physical exams with health scoring, hygiene scoring, and body condition scoring. I have included the Wisconsin calf health scoring chart here. I know it's a lot to take in. This is by no means included for memorization purposes. The biggest takeaway is that a 0 indicates an apparently healthy animal, and a 3 indicates the most severe in terms of clinical signs. The health scoring protocol includes cough, ear, eye, nasal discharge, fecal, and rectal temperature scoring. Like this chart for demonstrating how we are approaching hygiene scoring, it is scored from 1 to 3, with 1 indicating known to mild contamination with organic material, 2 indicating moderate contamination, and 3 indicating severe coverage with fecal matter and dirt, etc. On to the fun part, results. So this heat map shows the average health scores for each age group. Each age group contains 40 animals. Green indicates the lowest severity with a mean score less than 0.5. Yellow shows a middle or moderate clinical severity with a score of 0.5 to 1.5. And orange demonstrates the greatest severity of clinical signs with a score greater than 1.5. Per protocol, rectal temperatures were not obtained on neonate calves. Rectal temperature appears to be the greatest indicator of clinical severity. Other scoring parameters indicate clinically healthy animals or those with only mild to moderate clinical signs. These pie charts show the comparison of body condition scoring for the 3 age groups. In neonates and pre-weaned calves, body condition scores are done from 1 to 3, with 1 being under conditioned, 2 being ideal, and 3 being over conditioned. As you can see, the majority of animals in these 2 age groups fall into that ideal category. Post-wean calves are scored 1 to 5, with 1 indicating emaciation all the way to 5 indicating obesity. And that 2, 3, 4, 2 indicates under conditioning, 3 indicates ideal, and 4 is over conditioned. So no animals from our studies so far have fallen into the 1 or 5 category. Most are either slightly over conditioned or ideal in that post-weaned age group. This is the respiratory ultrasound scoring system. 0 indicates no evidence of disease. 1, which is pleural irritation, that's rarely seen. A score of 2 indicates small spots of consolidation. When I say consolidation, I mean patches of lung that are filled with fluid instead of filled with air like they should be. And this is an indicator of pneumonia. 3 indicates an entire lung lobe that's filled with fluid. 4 is 2 lung lobes, and 5 is the most clinically severe with 3 or more lung lobes affected. Cows do have a total of 7 lung lobes. Here are the results of our respiratory ultrasonography, which was performed on pre-weaned and post-weaned age groups. About 48% of animals had a score of 2 or greater, indicating high prevalence of pneumonia in these age groups. Scoring was comparable between pre-weaned and post-weaned animals. And here are the results for the nasal swab respiratory pathogen panel. The most common respiratory disease across both age groups was bovine coronavirus. Both age groups, especially the post-wean calves, also had presence of the trifecta of bacteria most commonly associated with bovine respiratory disease. So that's Pasteurella, Mannheimia, and Histophilus. The presence of mycoplasma in pre-weaned calves is also significant, as this species of bacteria is a concern in dairy herds because of the potential to spread to the milking population and cause disease such as mastitis and respiratory disease. Coccidia, or Eimeria, was the most common intestinal parasite. The only other parasite detected was a rare Giardia, only in a single animal. The overall prevalence of Coccidia was 47% across all age groups. So the take-home messages regarding this data collection and impacts for producers are that clinical signs such as cough and nasal discharge can be a poor indicator of underlying respiratory disease. Almost half of animals sampled had evidence of pneumonia on ultrasound, but this did not correlate well with clinical signs of disease. The most common respiratory pathogen for both pre- and post-wean calves was bovine coronavirus, and Mycoplasma bovis is also biologically significant as it can cause persistent disease in the milking herd. Additionally, almost half of calves had coccidiosis. The morbidity or prevalence of disease may be higher than the initial estimates we had of about 30% of the herd. I look forward to collecting more data over the next year and a half to better serve our veterinary species and our organic dairy producers.